Hi, and welcome back to ISCT TV. I have with me here Professor Okano from the Japanese Society of Regenerative Medicine. Welcome, Professor. It's so lovely to have you here. So a lot of people don't know that ISCT and JSRM have been working together for some time. Do you want to tell us about some of the initiatives we have?
Yes, actually, so we are working hard to translate IPS technology into clinics and working together.
Yeah.
And so, next year we have the ISCT and JSRM joint symposium, one-day symposium next year in Kobe, and so also we are planning in the 2028, and so there are lots of issues working the IPS cells again.
Yeah. So what have been some of the issues around IPS cells, and especially what are some of the roadblocks with getting them into the clinic?
Oh, yes. So in addition to IPS, and we are also collaborating extracellular vesicle and how to regulate them, and so it's totally unknown, But so we have to make some rule, okay. Otherwise, some many dubious, trial, is about to start. So we need appropriate regulation. That's JSRM and ISCT is working together. Professor Terai in the Niigata University is now the responsible person from JSRM.
Right. Yeah. I mean, it's so important to get those regulations out front so that we don't have, like you say, these dubious therapies being sold to our patients.
Yes.
So have you been enjoying the meetings so far?
Oh yeah, very enjoying. So
what's been your key best moment?
Yeah, lots of manufacturing related session was very informative. Yeah, so in JSRM, so not so much, and so I'm also the member of the ISCR, but so such a manufacturing process is not so active. ISCR more as a basic, and so and of course they include clinical translation, but so the session of the dedicated manufacturing process is. We don't have so much, so yeah.
And so you've been enjoying seeing it all come together.
Yeah,
it's really great. So you're going to go to the gala dinner tonight?
Oh, unfortunately, I have to go back to Japan.
No.
Yeah.
All right. Thank you so much for joining us today. We really appreciate it. Actually, we can cut that bit out because I'm going to say to you, would you like to share some with our audience something about the work you're doing? Oh, wait, I'll say that again though. Would you like to share with the audience about some of the work that you've been doing?
Yeah, okay. So I have presented the plenary lecture today, and so I talk about first in human clinical trial for the IPS-based cell therapy for the spinal cord injury, and so we talk about its outcome, the safety and efficacy, and so I believe that it was a very good response. Lots of questions came from the audience. I'm very happy to that.
That's fantastic. Thank you so much for joining us. We really appreciate your time.
Okay.
Thanks, everyone.